Castle Park Dental Care, and we're just really, really pleased that you're able to come and join us. In a minute I'm going to hand over to Chris, and he's going to talk to you about how we come to write the book, why he wrote it, what it means to him. But before that, I'd just like to say a few words about the man himself. Chris, as many of you know, is a Lancashire lad, really, really proud of his roots. Graduated at Leeds University. He worked in Hull for a little bit where he met Fran, and they settled in Beverley. They've got 2 kids, they've got Edward and Harriet. And Edward and Harriet both spent some time with us this summer helping out at the practice, which is great. And they've, as well as helping out at the practice and supporting the practice locally, they support him with his charity work, with his visits to Morocco, and I know that means a lot to him as well. Chris has also passed on his passion for dentistry to Edward, and he's going to be joining us in January next year as our hygiene therapist, and we're really looking forward to that, so it'd be great to have him on board. Branfield and Son, it'd be really, really good. Chris, as you know, has put his heart and his soul into Castle Park Dental Care. He's lived it, he's breathed it, he's invested in it, he's researched it, and it just runs through his veins. He's got this massive, unquenchable thirst for learning. There's not a day that he doesn't come in and he tells us something new he's been reading or something that he's learned. And he'll often say, well, I've learned it now, I can't unlearn it, I've got to do it. And so there we are, we're on the next step and we're off again. But that means he's invested massively in his equipment, with lasers, with CAD cams. We've got a fantastic bunch of people that work with us. It's not just us, we've got different people that come. We've got Plan Mech, we've got Julie, we've got the labs, to all do a fab job, and we work together brilliantly. And between us, we do look after the patients the best way that we possibly can, the best way on the planet, we think. And as the book says, we're not just about teeth, we're about people with the whole life-changing package. As well as investing in equipment and himself, we're now receiving referrals from other dentists, which is absolutely fantastic. And we're receiving referrals from patients. So our patients have had such a wonderful experience and love us that much that they're referring their friends and their families. And that makes us feel so proud, because the testimonials we get are absolutely amazing. Chris, as well, has also had a bit of TV fame. Okay? And as many of you have perhaps seen him on the Sensodyne ad, the day that they came into the practice, it's such good fun. We shut down the practice. We had a right good chuckle at him getting his foundation on and his lippy. We wondered if he was any good at cleansing and turning when he got home, or if he left it on the mirror, on the pillowcase. But that was a really, really good day. And love the ad or hate the ad, I think he's become quite a familiar face in many houses. I think it seemed to be when I was watching Grand Force or Grand Designs or whatever he pop up. There he goes again. But he's got quite a fan club. We got emails from South Africa. There was 2 or 3 ladies that quite often email us because they liked him that much. And then more recently we had a girl that emailed in and said that her mum was that buzzed up with the ad that would he send a picture and would he say hello because it was a birthday. So he wrote happy birthday, and I can't remember the name, but he held it up, took his photo, and we emailed it back and said it's just the sort of guy he is. It was good. So about me and Chris, I've worked for him. I didn't realise how long it was until I was asked to actually come and introduce him. It's almost 20 years on and off. And over the past 20 years, it's not just been a work colleague, not just been my boss, but he's a friend as well. And it's great working at Castle Park. I first met him at Bridlington Access Centre when I was a trainee, and I knew absolutely nothing about dentistry. And I'd get in to work with him, and he got this rookie nurse. But he did teach me, and he didn't mind teaching me, and if I didn't learn properly, he'd go over and over and over again until I got it. And I'm sure I really, really wasn't an easy student. But he did, he taught me like he teaches everybody else that comes into our practice. And in the early days, He was a bit of a baby face. He looked a little bit different to what he does now. He actually grew a beard to make him look older. And I remember one little lady coming in, and she'd go, "You don't like that beard, it doesn't suit you, get rid of it." And Chris would explain to her each time that, well, I've grown it because people think that I'm young. They think that I've only just qualified. They're asking me how long I've been in dentistry, and I've grown it so that I look a bit older. And she said, "Well, I don't care, I still don't like it." And a couple of months ago I was on the reception, and she came in again, and she went in to see him, and she came out and she says, "I don't like that beard, it makes him look so old." So I don't know if it's stopping or it's not, but that's the man. I also worked at an orthodontic practice with Chris for a little while. Not for long, but Chris being Chris, researched and did his stuff, did his homework, and it wasn't long before he was having a word with the orthodontist and putting a right on a few things. I'm not sure how well that went, but he did. And then after that, once I qualified, we went to work together where I was an associate, just around the corner from where we are now. And even then, he was a perfectionist. Before he had his own practice, he was just an associate. And if my nursing wasn't quite up to scratch, he'd soon let me know that I'd gone off the boil. In 2008, he bought Castle Park Dental Care. He became the principal. And a couple of years after that, I got a phone call from him, and he said that he was in the market for a practice manager, and was he interested? And of course, I jumped at it. And that was the start of the next journey. We worked together, we've recruited an absolute fantastic team, we've got a great team now, and we just work so well together, we just do some great stuff. And after a while it became obvious that the little practice up the road was just too little for Chris's vision and where he wanted to be. So we decided that we needed to move, and it was all a bit of a rush, but we kitted out, and we've moved into purpose-built practice all within 12 weeks. I think we had 1 day downtime, and again that was working with the suppliers, the chair people, just to get it all up and running. Because we've got all that extra room, we can now sort of expand, and we've got to the point now where we're looking at can we fit any more? Is there any little corners that we haven't used yet? So that's where we are now. And then the next thing I did with Chris was get involved with Dental Mavericks. And Chris is, as many of you probably know, is founder member, a trustee and the clinical director of the Dental Mavericks. And I think this year is his 14th trip, his 14th expedition that is going on. And he's done absolutely fantastic work with them. He's done loads and loads of fundraising, and he's even been with Edward and climbed up Mount Tuco, which I think was no mean feat. I don't think it was really, really difficult, but it was, you know, it was a great effort. And next week there's myself and our lead nurse Nadine. We're going to have the privilege to go with him again and to work and look after the children who've got absolutely no access to dental care at all. It's just so humbling to be there and to look after them. They've got nothing, they expect nothing. The clothes that they come to see us in, they wear the same clothes whether it's summer, whether it's winter. But you know, they're so appreciative when you look after them, they're so appreciative, and the big smiles, and they're absolutely wonderful little kids. And then you stand back and you look at what they've got and look what we've got, and it really sort of puts it all into perspective. That we're just so privileged, and you know, just for us to get involved and look after them, it's massive. And Chris, when he's there with the Mavericks, the Mavericks anchor man. If anything gets a bit tricky, there's normally a handful of dentists, but if anything gets a bit tricky, a bit difficult, things not going quite right, it's the first name on anybody's lips that shout for Chris, go get Chris, go get this, let's see sort it out. And he goes, he sorts them out and he looks at them, and the little kids go away and get them put right, and it's brilliant. So before I ask everybody to raise the glasses in a toast, I'd just like to say on a very personal note, Chris, thank you very much, it's been a blast. Now, ladies and gentlemen, I ask you to raise your glasses. Can you be upstanding? And can you raise a toast to Chris Branfield, a dentist, with a passion and a purpose. Thank you.
Cheers. Cheers.